I'm Lani Madsen, and this is a reader feedback edition of Forthright. Reading a February 10th column inspired by my mother's 90th birthday, and a few thoughts on living well or living in fear, as published in the Spokane Review. 2 years after the start of a pandemic was declared, it's past time to talk about balancing quality of life and fear of death. For the sake of our health, it's time to move on. Some are moving faster than others. Mom saw an invitation on social media and thought it was an exercise class. Since she was already back in person at her old fitness class Monday, Wednesday, Friday, the Tuesday, Thursday schedule for a virtual class would nicely round out the week without having to drive every day. So she signed up. It wasn't a good fit for an active senior citizen and former nursing professor. Her class evaluation form will be full of pedagogical suggestions to aging and long-term care of Eastern Washington for improvement. Her reaction to the class might diplomatically be described as disappointed. In fairness to the folks at Aging and Long-Term Care, she wasn't the target demographic. The evidence-based curriculum is titled, A Matter of Balance, Managing Concerns About Falls. Mom isn't overly concerned about falling, even though she just turned 90 years old. She's been attending her senior aerobics class for 28 years and still lives in a house where she uses multiple trips up and down stairs as good exercise, made safer with added handrails on both sides. Safer, but not absolutely safe. Nothing in life is risk-free, including sitting in fear at home, giving up on hobbies, and losing contact with people. That's the target audience, according to Kathy Hill, a trainer for the Matter of Balance program. Average age of students is 79, serving those who have limited their lives because of fear of falling. It's not an unfounded fear. According to a 2018 plan issued by the State Department of Health, Washington has the 14th highest fall-related death rate for adults 65 and older. The number, which has increased 28% since 2000, stood at 82.6 deaths per 100,000 population in 2016 and has continued climbing. The national average is 64 per 100,000. Spokane County had the highest rate of hospitalizations and deaths among all the larger Washington counties. Falls are a primary cause of fatal injury in older adults. According to Hill, the decision was made in 2015 to present an evidence-based fall prevention program, which brings us back to the dozen seniors and an instructor zooming to better health in 2022. Mom was not impressed with an hour and a half of how to get up off the floor, safety topics like why house slippers are dangerous, and a short-seated exercise routine of light stretches. I've been exercising my entire life, said Mom. Our dad had my brother and I practice falling when we were under 10 years old. He told us there was a way to fall and not get hurt. He also started us boxing with big padded gloves at the same age. End of quote. A lifelong Spokaneite, Mom grew up outdoors in a pickup neighborhood ball games, sledding, skating, camping, hiking, hunting, swimming, fishing, playing every high school sport open to girls in the late 1940s. She didn't stop riding a bike until her 70s and ice skated until she took a spill on the ice trying to keep up with her hockey-playing grandson in her 80s. Mom had just filled out the class survey, proudly noting she hadn't fallen in 3 years when she slipped on sheer ice in a parking lot last month. The landing gave her a shiner where her glasses hit her forehead, but she got up and carried on with the day. Those early lessons in falling gracefully must have helped. Clearly, Mom is already managing her concerns well. She trains, she's careful, and she carries on. She's fully back to her normal routine after the shutdowns of 2020 interrupted both exercise classes and casual neighborhood gatherings with friends. But the shrinking of her world had a significant impact on her quality of life. Vaccination and reopening gyms in 2021 came just in time to prevent deeper impact on her physical health. That's the demographic that fall prevention programs like A Matter of Balance are seeking to reach. Adults who lose connections and limit activities out of fear are likely to be on a fast track to an early death. Kathy Hill reported they do have satisfied clients. Quote, a gentleman in a previous class said he had stopped fishing, and as a result of the class, he figured out a way to go fishing again and recover a hobby he really enjoyed, something he'd stopped doing because he was afraid he would fall. end quote. Insufficient physical activity and isolation are not healthy at any age. Living in a state of hypervigilance, whether in fear of falling with every step or in fear of disease in every breath of air, is not healthy. For the sake of our health, it's time to move on. My first email after that column published was from a frequent correspondent, Bill Reynolds, who said, "How many times does Scripture admonish, 'Fear not'? Therefore, I think your advice is on a rock-solid foundation." In 2020, when the standard goodbye always seemed to be stay safe, I started saying live adventurously. Staying safe is a very low bar for living. From Joseph, a Spokane veterinarian, Joseph writes, and I quote, "The effects of the lockdowns on society as a whole are worse than the virus affecting individuals, especially those with pre-existing comorbidities. The unwillingness of the left and medical authorities, especially the WHO, to acknowledge and name the virus as Chinese, as opposed to previous medical standards with other epidemics, has always left me doubting government efforts. As crazy as Trump was, he tackled it head on and with vaccine productions." Well, Joseph, I agree. Our public health leadership has done a poor job of balancing risks and benefits of lockdowns and other extreme measures. I fear we'll pay the price of blown credibility in some future epidemic or pandemic. And we are currently paying a price. From a January 25th, 2022 article in the Financial Times, a source rated as least biased by media bias fact check and with a high rating for factual content. The title of the article is "How the Biden Administration Failed the Omicron Test," and the subtitle is "The New Variant Has Exposed Dysfunction in America's Public Health Institutions That Has Continued Under a New President." I'm going to paraphrase pieces of it here. You can check the Substack post for a link to the full article. Basically, it's saying that Operation Warp Speed accelerated vaccine development and worked on lining up manufacturing facilities before the vaccines had even received emergency use authorization. Both of those are working with the private sector, the things that the public health system really isn't set up to do. A quote, "Even Trump's worst critics would agree that the rapid development of vaccines has been an unmitigated success story, but one of Biden's first actions after entering office was to scrap the Operation Warp Speed name and integrate its members more fully into the traditional bureaucratic structures at the health department." End quote. And it's the traditional bureaucratic health structures that are the problem. Biden abandoned everything that had been working about warp speed that allowed it to cut through those agency turf wars and the bureaucracy, and therein lies the problem, a bureaucracy that the Financial Times describes as, quote, "the U.S.'s creaking public health infrastructure," end quote. And now everyone's frustration is topped off by the 2022 Super Bowl and 70,000 unmasked fans ignoring public health warnings to stay safe. One more reader email from a woman who appreciated the timing of a column on living well instead of living in fear. From Sherry. "I have lived 2 years waiting for the shoe to drop. My turn to get COVID. Not planning on vacations. Not traveling. I hate the person I have become. I don't trust our president, his medical advisor, the CDC, the governor, or the news outlets that sensationalize the pandemic. We have had all our vaccines, but my son and his wife still haven't vaccinated their children. She is a nurse, and the data isn't there for long-term effects. I was shaken to the bone by 9/11. However, we just did what we had to do to deal with it and learn to live in the post-9/11 world. When are we going to let the people free to deal with it and live again? We can't stay inside or wear masks forever. Well, I can't." And Sherry, I agree. Neither can I. And I'm done. Thank you for joining me on this edition of Forthright. You can follow my posts at Lani Madsen on Substack and find my columns published every Thursday in the Spokesman Review.